Welcome to the MIT IT Innovation Program podcast. This is a repository of insights by thought leaders and practitioners of innovation where they speak about their views, insights, and experiences. Come join us.
Hello everyone and welcome to today's webinar, Healthcare Innovations for Today. My name is Priya Dhawan and I'll be your moderator. I work as the Head of Collaborations, Branding and Outreach at the MIT ID Innovation Program, and I'm excited to be hosting the session today. I'm pleased to introduce today's speaker, Mr. Pushkar Ingale. Pushkar is a design, innovation and strategy professional. He has presented several webinars and today he's going to share about his journey and his healthcare-focused innovations along the way. Pushkar is an Innovation Fellow from the Stanford India Biodesign Fellowship 2010. A mechanical engineer, he went on to complete his Masters in Design, specializing in industrial design from IIT Bombay. A TEDx speaker and is a frequent panel member at MedTech and Innovation Symposiums. Along with a keen interest in academics, he is a visiting faculty at design and engineering schools, including the MIT ID Innovation Program. His work experience includes stints at Sandvik Coromant, Bajaj Auto Limited, before he turned to full-fledged entrepreneurship. As a Stanford Biodesign Fellow, he identified an unmet need in detection of hearing loss in newborns and is a co-inventor on a screening device to detect neonatal hearing loss. Amongst his many achievements, innovation for behavior change strategies for scale-up of kangaroo mother care, recognized as the most innovative medical device, for which he received an award in 2016 by the Stanford School of Medicine and American Indian Foundation. The Uterus Collection awarded with CII Design Excellence Award for Healthcare category, as well as overall winner in the Industrial Design category. Pushkar has also been awarded the BIRAC Sparsh grant by DBT to develop a novel affordable video laryngoscope to gain emergency airway access in patients. Before we proceed to listen to Pushkar, I have a few updates to share about this session and the MIT ID Innovation Program webinar platform. Firstly, today's webinar will have the speaker share his insights for the first half hour, followed by a Q&A session in the latter half hour. Next, we'd love to hear from you during today's webinar. If you have a question for our speaker, please feel free to send it through the Ask a Question tab at the bottom of your screen. We'll be answering questions at the end of the session. You can also send in your questions directly to me, just so that we do not end up, let's say, causing distractions during the webinar. If we don't get to your question during today's webinar, we will be sure to follow it up afterwards. This webinar will be available after the session on YouTube, and future webinars will be accessible through the same link you are using now. We'd like to encourage you to share today's webinar with your social networks. You can use the social sharing icons to post the webinar directly on LinkedIn, Instagram, Twitter, Facebook. And lastly, this curated series on healthcare innovations for today will feature a variety of industry thought leaders, speakers who are a part of the MIT ID innovation ecosystem. MIT here stands for the 4-decade-old Maharashtra Institute of Technology. ID stands for MIT's 15-year-old Institute of Design. And the one-year innovation program is the latest offering of MIT ID, which aims to create a new breed of comprehensive innovators informed by design thinking, influenced by future technologies and trends, and inspired to make their own mark in the global, political, social, economic, and technological scenario. So thank you all for listening in, and thank you all for coming in on time. I'd now like to welcome our speaker, Pushkar Ingale. Pushkar, over to you. May we have your video on, please? And I'm going to be with the video set off until the end of the webinar. Thank you.
Hi, good morning to all. Just want to do a video and a sound check. Priya, can I just have a affirmative reaction from you that it's all loud and clear?
Yes, to me it's all loud and clear.
My employer was very generous in his description, and innovation is something that users are using and it's creating an impact in their life. And to that extent, I'm an innovation facilitator for a few of my clients who come to me with their innovations, and I help them turn them into those ideas into tangible products or services or experiences for their clients. So they are the ones who are going out and deploying it, and that is what is helping their users use those innovations. So with that distinction, what I think is a good distinction between an innovator and a designer out in the open, I would like to kind of take you on a short journey. What am I doing today? How did I get into healthcare? And hopefully we'll have some good questions at the end of it. I got into healthcare innovation or healthcare design purely with a different passion in my mind. I was a designer in the making, and I had a chance to do an internship with somebody who is kind of a leading thought process designer in medical device design. And it kind of fascinated me. But then my first job, as Priya described, was with Bajaj Auto, and I was designing motorcycles, and I was doing really emotive products, kind of just working on how to make those motorcycles look good. It's an emotional product, isn't it? And then my thought kept reverberating back and forth, saying, "Oh, I do not see medical products as emotional. Have I seen them as emotional products? Never. I haven't seen somebody say, oh, that MRI machine looks so good." And that was my starting point. I was like so fascinated with the thought that medical products should look good. And that was a niche that I identified for myself, and I started looking at it, and the fellowship came along. And it kind of just changed my thinking. I mean, nobody buys a medical product because it looks good. It has to really, really bring value to the user. It has to bring value to the patient. It has to bring value to the healthcare provider. It has to bring value. Nobody ever buys a medical device for anything except the value that it brings forward to that. Together, let's take a look at what does healthcare innovation look like. So I kind of, in my mind, I break down healthcare innovation into three parts. The first part is the device space or the drug space, something that is actually treating, diagnosing, helping the doctor and the patient look at it. But a more important part, if you kind of look at it, the bigger umbrella is of the system design. How does it change at a long point? I mean, the earlier employer that I used to work with was in the space of training. They were innovating for training healthcare workers. And training requires a lot of behavior change. You're used to doing things in a certain way, and you're now being asked to do it in a right way or in a different way, perhaps. And when you are asked to change your behavior, there's a lot of resistance. Priya mentioned about the kangaroo mother care space. It doesn't need a device so as to speak to, but it needs a lot of hand-holding with mothers, especially in rural areas. They need a lot of counseling to tell them how to hold the baby in skin-to-skin contact. And then there will be a lot of behavior resistance to this thing. Okay, so going forward from that, how is healthcare innovation different? Healthcare innovation requires you to follow strict protocols in terms of if you're doing a device, you're probably affecting a patient's safety. So there are much more regulations, and the process is much more systematic than innovations in other spaces. You're doing innovation with the help of doctors. You can't do it alone. You're doing it in the space with different kinds of engineers, designers. So it's much more collaborative in that sense. And then it's also very persuasive and persistence driven, because often innovation in healthcare can be a much lengthier process than innovation in the other space, because there are very strict protocols as you develop your innovations and you put them in the hands of the patients and the doctors. So I probably exhausted 10 minutes, and I want to take you through what we are doing in this scenario of lockdown. So we reacted very quickly to this pandemic, in the sense all the innovations that you see, all the efforts that you see, they are more reactive than proactive. In the sense, now there is a rush and a scramble to get safety devices. There's a scramble to get ventilators, just because the system did not expect this burden. The healthcare system feels under-equipped. The doctors are stressed, the nurses are stressed, everybody is stressed about the patient overload that is expected in coming times. And the community, the maker community, has responded adequately. There are a lot of hackathons. People are designing ventilators on WhatsApp groups. And we, as a design group ourselves, we started seeing what is happening around the world. We were a part of a lot of these groups. And one thing that caught our eye as a low-hanging fruit was that a lot of people started printing face shields. And we said, oh, we have a 3D printer back here, and let's contribute to that cause. And as we started making them, we realized it's taking an agonizingly long time to make one. 3D printing is a very slow process, and we said, does this product even deserve 3D printing? And then we asked, is the face shield even that important as a device for us to spend our energy, since so many other people are already working on it? But we just said that let's just make an idea that anybody can make, even a child should be able to make. All these kids are at home. If they start making them, probably it will spread. So we made an idea, we made a small video, and we put it out there with a big disclaimer saying we don't think this is a perfect design because we have not had chance to meet this design on there and get their reactions. But the reactions started coming in really, really fast, and that kind of led to discussions wherein the discussions are not around the face shield anymore. We just got connected to so many doctors who started telling us the face shield should be much more than what a face shield is because there are no masks. And those discussions have led to a group, a very focused group that has come together to work on meaningful devices. When I look back on this experience, what I would like to highlight is when we are doing healthcare innovations, we are asking, are we working on the right problem? Now, when we say what is a right problem, let me try to emphasize that with an example. Let's take the ventilators. You must have seen a lot of people are working on ventilators. We asked ourselves, should we be working on another ventilator? And then we said, let's categorize all the problems that we have. So we went with this exercise of listing down all the challenges that the healthcare system is observing in other countries. We need ventilators, we need gloves, we need masks, we need protective equipment. And we started breaking down in terms of impact. We started to apply an impact filter. The ventilator has the biggest impact in terms of saving life who needs that support. But how many people actually will go on a ventilator? We started breaking that down. So if you look at the current estimates, 5% of the people who get admitted to the ICU, 5% of those people will probably need ventilator support. So okay, that was a big, that's a small number in the larger scale, but it's got a big impact. So we need to balance out our choices. Then we said, okay, what's happening next? We were talking to all these doctors who saw our face shields, and the overarchingly bigger demand was that these doctors should not fall sick. So we looked at what is happening around, and we say, for example, in India right now, as we speak, the latest news says 60 doctors are already affected by this virus. And when we looked at what's happening in Italy, 10,000 healthcare providers are already sick with this virus. Now that's a huge setback to the health system. If these frontline workers who are skilled in this job of ventilating, treating, if they fall sick, that's going to be a much bigger impact. Then those ventilators don't even make sense being out there if there's not a skilled health provider who can ventilate a patient. And that space opened up saying we need to do everything to prevent these doctors from falling sick. So all our efforts right now, we are working on 5 or 6 ideas at the moment. They're all focused around not getting these frontline healthcare workers sick. The second challenge has been, let's assume we are a group, we are in a lockdown, we are all working remotely. What happens if we come up with an idea? How can we get it out there? One effective way is empower people around in the surroundings of these hospitals to make it. And that's where DIY solutions work. But DIY solutions are often trade-offs between efficiency and what is available around you. So we have been thinking, how can we get devices that we probably design or are already well designed in the hands of the doctors? That is where the system approach has helped us think, can we rope in manufacturers? Luckily, we have been in the network that we have. Manufacturers are now stepping up saying, can we utilize your designs or these other designs? That has now led us to think, how can we evolve a network or a communication medium that addresses where is the stock, where is the need, and connect these endpoints so as to get these goods into the hands of the people. An interesting thing has happened over the last couple of days in the 3D makerspace community. People were doing ad hoc things, people were printing, and they were just supplying. Somebody very creatively came up with a network that lists all 3D printers in the town and connects it with doctors who need 3D printing services or who will volunteer their 3D printing services to these end doctors. So now it's getting into a system space. So you saw it started out as a device thing. Now it's getting into the system space. But now the bigger challenge is behavior. What I'm understanding talking to a lot of these doctors is that you getting out the space shields to the doctors is not enough. You need to get it out to people who are going to be in public contact. You need to get it out to police people. You need to get it out to sanitary workers. You need to get it out to a lot more other people who are in public contact. Now the challenge is doctors know how to use these devices in the sense, even when you wear a glove, there's a technique. Your glove is contaminated on the outside. You don't want to take it off in such a way that you contaminate yourself. Now the bigger challenge is with all these equipment that everyone use, how do you help people understand the behavior around these techniques? How many people have started using soaps and sanitizers, and now our efforts kind of distilled down to behavior change techniques. We are trying to understand what can we do to affect behaviors. As we start our needs finding in the behavior space, we understand that a lot of our community is working from home and they're reading news much more than they are doing. And there's a lot of negativity and it's affecting their mind space. People are getting anxious, people are getting paranoid to a certain level, and people are in a fear whether the economy is going to go bust, whether people are going to be safe in their surroundings. So a big need has emerged in the space of mental well-being or helping people stay calm. And I think healthcare, the definition of healthcare needs to be extended to well-being. If you are in a space of well-being, only then you can be in a space of healthcare. So what I wanted to emphasize is how you should be able to scale the problem down to a more specific thing of activity, but also kind of keep your mind open to scale it back towards an area wherein the scale back shows you more opportunities to innovate and help the society in general. The last part of my webinar, I would like to focus on being reactive versus being proactive. I think everybody is reacting now because the system is strained, but could there have been a proactive way to design the healthcare system? So such scenarios, such extreme scenarios help us look back and prepare for the future. Now, going forward, what is likely to happen if we start thinking? I think we have tremendous scope in terms of system design. I think our system has not evolved with the pace the pandemic has evolved. So what could be done to strengthen the system, the procurement system, the access system? And that brings the focus on public health versus private health. Right now, if you see the entire focus has segregated the entire public health, and the private health is likely to follow as this system gets saturated. But there is a distinct disconnect between these two systems. There's also an hello. Yeah, I just want to do a sound check if we are still audible, because I see some messages pouring in for not audible, sound not being audible. Yeah, I trust no reactions more. So yeah.
Right. Audible.
Yeah. Yeah. Going forward. I think healthcare system needs to be more collaborative. I see this is more like getting into the future, what is likely to happen. I think for the first time, it is becoming very visible how doctors are working together with engineers and designers and innovators to create new solutions. Future wherein hospitals will have design departments, they will have innovation departments within themselves, and they will be doing a lot more innovation in terms of systems, devices, and practices. I see a lot of people working together with psychologists. I foresee a space wherein psychologists, doctors, and designers are coming together to create solutions for mental well-being. It's going to be a focus area in a much bigger way as the world picks up pace. And I'm hoping that we kind of bringing this back to education, since this webinar is being hosted by an academic university. I hope we are able to tear down the walls between the engineering, the management, and the design institutes that exist on the campuses. I foresee education programs being more inclusive, agnostic of our education backgrounds, and that cross-pollinating culture evolving from the grounds up. Only when we break down the silos at the education, I think we will have a culture of cross-pollination at a more professional level. That's my wish. That's my wishful thinking. As I have seen myself benefiting by being in an environment that is heavily saturated with doctors. To kind of sign off in the last few minutes, how can we, sitting at our homes, contribute? I think there are a few links circulating about hackathons, about groups that are actively talking. Be a part of those groups. If you see an idea, do not hesitate with the idea thinking it's probably been done. I think when you share an idea and you get those reactions from people who want to use that idea, it opens up new avenues to take that idea to the next level. And if possible, work in groups that you enjoy working with. Let's take this opportunity to bring more innovations. Innovations, as I would like to reiterate, are ones that people want to use. And if you can share those innovations with people who want to use, you will get all the right feedback to take them to a more practical level, wherein somebody wants to then manufacture it in big levels and bring it to the people for impact. Yeah, I would like to stop my monologue at this level. And I'm kind of curious to see if people have questions that I can answer. Over to you, Priya.
Thank you. Thank you so much for your insights, Pushkar, in the pre-COVID as well as during the COVID era. And I'm hoping that, with that many more minds put together and hands put together, we'll hope to save difficult situations. At my end, I'm curious to know when you that you have an innovation.
My parents say they felt I had an innovation bent of mind. I don't think I'm innovating enough in the sense, I think I have a maker's mind. I like to build things, I like to break things. I think I got the tag of the innovator just by being in the program. I'm not trying to sound modest at all in any way, but I think that's a difficult question. I think I've been like that since being a kid. I think I've been an introvert. I've enjoyed more activities that I enjoyed doing myself, and that led me to probably being too much busy with crafts and mechano kits and things like that. I think it's just led to it's been very serendipitous in that sense. I just happen to meet people who help me build innovations in some small way or the other. Yeah.
Sure. So I think creativity is the key word then. So you feel that being a maker and being able to create something should be like, let's say, the first step to hopping onto the innovation bandwagon.
Let me pause a bit. I think creativity is the foundation, but now with reflections, I can say being an observer is a bigger asset in terms of innovation. You could only innovate if you can observe some of the struggles around you. I think that's a new skill over the last decade. Earlier, you would build for yourself. As an innovator, you want to build for somebody else. To build for somebody else, you need to really observe and understand the person really well in their mind.
Right, great. So Ojaswini has a question here. She says, can we also say that innovation is the new invention? Like we talked about design and innovation, she wants to understand what about Jugaad? How do you, how will you be able to, simplify it for her?
Thanks, Ojaswini, for bringing this up. I hate and love Jugaad. It's a hate-love relationship. What what I started off in terms of describing the face shield, it's a jugaad. I hope the jugaad gets institutionalized and formalized in a design and then gets into a formal feedback mechanism and iterative and become an innovation. The challenge is if we celebrate jugaad for too long a time, it does not get institutionalized. Jugaad, in my sense, is getting done away with the situation, but it is not sustainable in the long time. You have to formalize it. So I love Jugaad because it sows the idea, but then I think it has to translate into being an innovation that a large Jugaad is not scalable. It's not formal in that sense. It's a make-do situation in the situation that you are, but you need to be much more formal for it to become an innovation. And in terms of invention versus innovation, invention is if the invention, nobody wants that invention, it stays an invention. It's really good as an idea, but it has to translate into a demand that people want to use again and again. That's where innovation space is. Okay, I see another question. Should I take that about data and healthcare?
Right, I was just about to share the same. So Abhishek Behera would like to know that how to use data wisely in healthcare space for innovation. How do you basically put data and healthcare together?
So I'll split this. I'll split my answer around data in two parts. The first data that I use as an innovator is how many people will I impact? Do people want this innovation in terms of that? So it helps me make my choices. If I have a limited amount of time, if I have a limited amount of money, and if I have a limited amount of bandwidth, it will be wise to use that data to choose the problem you can work with. The second part of it is, can I use data as an innovation by itself? And I think that's the bigger space that is opening up. I'm not an expert of data science, neither do I build solutions that use data, but I'm an observer of that space. It kind of opens up interesting possibilities in terms of how can I deploy my solution. So I'm an observer of the data science space in terms of using data for innovation, but at the moment I'm just using it to make choices about what I should be working on. Using data to change the solution as a software system, I'm kind of a slightly distant observer in that space.
Sure. So Subbu Kanmani had a question.
Yeah.
Or rather a suggestion. He said injection molding is best for mass production of face shield straps. However, the 3D printing helps to check the idea and design of the face shield straps as initial step. Any additions or any inputs to that?
Yeah, I want to bring it back to Ojaswini's question. I think if I have to react to that statement, if you do a DIY thing that anybody can make, that's jugaad. A slightly formal way is because supply chains are affected and injection molding is probably, let's say injection molding is happening in Mumbai, but my need is more distant. My need is more urgent in Pune. Then if the 3D community space is supplying, it's still a formal innovation in that sense. And as and when these factories get started, their tools get ready and they are able to supply, I think the jugaad and the 3D community space will cease to exist and the formal system will take over. So all have their spaces in the system, and jugaad will be more immediate and 3D printing will be slightly incremental, and the injection molding space will react slightly later. Does that make any sense?
We'll take it offline with Subbu, I'm sure, in case he wants to know further. He would also like to know that can innovation happen by compulsion?
I think we are in that space right now, aren't we? So,
right.
Yeah. Right. Innovation, necessity is the mother of invention. I think compulsion can lead to innovation. It often always leads to innovation, I think.
Right. Cynthia Varshini would like to know any advice from you on having a startup in the healthcare space, given that she doesn't have a design background.
More and more I'm becoming agnostic to backgrounds. I think it's the motivation that matters. For example, I would be foolish to think that I understand patients very well. I understand clinical anatomy very well. So that should not be the hesitation to not be in that space. I think getting a good team that can work with you uh, can lead to a good innovation in the healthcare space. I think what I would like to reiterate is I'm just sometimes a facilitator. Most often, most of my brilliant ideas have come from the doctors I work with because they know what they are requesting. My job is to interpret what they are and kind of take their idea to a more tangible space. So I've become more agnostic about backgrounds more recently. Even at the innovation program that MIT hosts, my most joy has come from working with people from extremely different backgrounds who work together. I think there's power to being diverse in a team.
And Pushkar, beyond, of course, being a part of the MIT ID innovation program, which are the other ways and modes that people can reach out to you? Because there are quite a few questions in terms of which may be very, very, I think, distinct. Like, for example, like the causal loop diagram, what all are the guiding aids for system design? I think Ojaswini would possibly take this offline with you. Because the larger fraternity out here may not be really understanding the term causal loop diagram. So where else are you available that Ojaswini can connect with you one-to-one
I have become
for this question?
yeah, since the lockdown, I think we've become more active virtually now. I'm fairly active on LinkedIn now in the times of lockdown, so that's one way. Find Pushkar Ingale on LinkedIn. Probably there are only two, so you will see my face and recognize me. The other way is I can leave my email ID over here, and it's Pushkar@Cohesive Labs. I'll just type it out in the chat space as well. So it's Pushkar@cohesivelabs.in. So if you want to be more direct, then email is also a way to reach out to me.
Okay, can you set the chat mode to everyone so that the email ID is seen by all?
Okay.
Okay, I don't have the name of the user who's using the Galaxy M30, but the question is, what is the role of the designer in healthcare systems exactly? Is it just the aesthetics and ergonomics? Because mostly it's mechanisms and electronics.
That's such a good question. Thank you for that question. It's a fantastic question. So I think our role is much more than that. Let me encompass that. I'm an engineer by my initial background, and as engineers, my first reaction to any problem is to I have a solution. Let me just build it. As a doctor, innovative doctors are a rare breed in the sense the experimental mindset in a doctor is often curbed by the position that the doctor is in. There's little scope for experiments, if you understand what I'm trying to say. And as a designer, one of the tagline a designer my professors described was, who is a designer? A designer is a jack of all trades but a master in design. And I think that mindset helps being a designer in a team. If you ask me what is my role when I go in a healthcare system, I start off as an observer. I'm a silent observer. I stay in the room and I'm just looking for what are people doing? What are people's mindsets? What is the nurse doing? How much time does it take for her to fetch a device from a position on the shelf to the patient? How many things does she touch? So I'm just observing and I'm kind of internalizing all of those observations for the focus I am in the hospital. The second thing often is to kind of come up with a spec sheet. A lot of times there is a feature creep. We want to build a device that does everything. And as a designer, it helps me question, the designer mindset helps me question what is important what is nice to have and what is redundant. And then we have to kind of come up with a minimum value proposition, the MVP as everybody calls it. And we have to kind of put it there. But then my role of observer kicks in again. I'm looking for reactions. Sometimes people are not able to articulate very clearly what they really want. And that interpretation helps you kind of help these guys articulate. So most often I'm asking provocative questions to doctors and engineers saying, why do they want that, what they want? And if you ask a doctor, do you have a problem? Uh, 70% of the time I have received a question saying, no, I don't have a problem. And that is because of their dogma of doing things the way they do every time. If I ask an engineer, can you solve the problem? They want to do too many things and make this perfect product. And my role as a designer is to say, let's make this iteration, let's fail there, and let's build the next one. Only when I have done all of that do I start thinking about the aesthetics. I'm very passionate about bringing emotion to the products because, as Dan Norman said, beautiful products behave better. And if people love the products that they are using, they are likely to perform better psychologically for the users. So the aesthetics and the ergonomics are important, but they come at a far end of my product design cycle. It more often starts with why am I building? What am I building? Is it good enough? And what can make it better?
Sure. Thank you. Siddesh would like to know that right now we are just reacting to this pandemic, but instead, can we put more efforts in the detection of such viruses, developing a system where every small case can be reported? And would that be a right approach?
I think you're asking something beyond my level of expertise. So take it with a pinch of salt. It's an opinion, not backed by any clinical expertise at this stage. My understanding of this thing is that you really need to know the virus and the biology to come up with a detection service. What you're hinting at is a screening. What they were doing is they're looking at temperatures and saying, okay, this is likely a candidate for further evaluation. That's screening, but you could have a strategy which is screening and then slightly better positive diagnostics and then confirmatory diagnostics. And after the treatment, you have to again redo the confirmatory diagnostics. Technology management in health space. I think everything goes with technology. I think what I kind of, there are chances wherein you come with a technology and you reapply that to a healthcare problem, but more than often those attempts sometimes have failed, more likely to fail. It's easy to start with a need and find the right match of technology. I'm more of a practitioner wherein I look for the problem first and then find suitable technologies. Not to say that technology is finding an application has never happened. So in terms of management, we so far do not. We found a good technology and we said, okay, we have often started with the problem and found a technology that made more sense. And being a designer, that has helped us more. I think if you were a technology inventor, you could have tried the reverse approach better.
Sure. Abhishek, Gaurav would like to know, in the face of COVID-19, how can we overcome the shortage of PPE, which is much simpler to manufacture compared to ventilators?
Yeah, I think we are so focused around that problem. I think we are short-staffed. We have shortage of stockage. And one of the bigger questions that I have been pondering about is the shortage comes from the fact that they are disposables. They need to be disposed of. We live in an era of disposable. It gives us mental peace that once I have used it and I've thrown it away, I don't have to worry about infection spreading. I don't have to worry about reprocessing. It's far more easier to burn it. But the question, when in terms of lockdowns, we are fumbling ourselves against is disposables the only way to think about it? Are there ways to reprocess this equipment so that if I have acquired a set of 10, can I keep reusing them at least twice, at least thrice? So that would be one possibility. The other possibility, as you rightly say, is can we innovate and make manufacturing of these things easier? If you look at a mask, what does it have? I mean, even if you look at the face shield, it's just a transparent sheet of plastic. So nobody is stopping us from coming up with creative ways to make this manufacturing easier. The more scientific personal protection equipment is slightly more sophisticated, and I would appeal to the creative community to come up with more innovations in that space. I think that's the first barrier, or that's the first level of innovations. That's the more urgent need for personal protection equipment than ventilator, in my opinion. Our all energies are focused right now around personal protection equipments right now than thinking about ventilators. I mean, if you lost all the healthcare workers to the pandemic because they didn't have protective equipment, all those ventilators are going to lie idle, right? That's the fearsome. I do not want to spread any fear, but that's the fearsome scenario if we extrapolate that.
Right. So there's one request by Sugandharama. Sugandharama, for any links to groups and hackathons, I would recommend that you follow us on our various social channels, and we will keep sharing information on the same. Pushkar, to you, the question is, could you share a bit about your experience at the, or rather during the Stanford India Biodesign Fellowship? Because very, very few Indians make it to that.
Yes, the program in India has now been rebranded as the School of International Biodesign, and you can look that up. The Stanford India Biodesign program, it was a joint program hosted by the Stanford University, the Ames Institute in Delhi, and IIT Delhi. And as a part of the program, they would select 4 individuals, very different backgrounds. One had to be a clinical practitioner or doctor of some kind. The second need was to be that of a designer. The third would be an engineer, and ideally the fourth would have been a business person, very often coming with an engineering background or a design background. And all these 4 people were put together as one team. We spent first 6 months at Stanford undergoing their biodesign course, wherein they taught a very systematic process that is followed in terms of identify how do you observe needs, how do you identify needs, how do you convert those needs into problem statements that you will work on. The second thing is how do you at the end with problems identified. So what is a good problem to choose, applying different filters. Then how do you convert that problem into a specification requirement, like what should the solution do, what are the basic minimum things that the solution should cater to, in terms of the clinical need, in terms of the invention need, in terms of the business need of the solution. And the fourth part would be to kind of build that entire thing and put it into an iterative testing. How do you go around documentation, around IP, intellectual property, and so on and so forth. But once those 6 months were over, we were back as a team in India, and we started working, applying that process to a need that we were observing. We were given a focus area, of course. My batch had a focus area of pediatrics, and we were looking for needs around the pediatric space. At the end of it, since this program was funded by the Department of Biotechnology, we could often spin into a startup and continue our entrepreneurial journey from there. So the program was less academic, but more facilitative towards an entrepreneurial journey to bring medtech innovation to India.
Sure. So from, let's say, learning at Stanford India to teaching at the MIT Innovation Program, how has the experience been, and what do you think is a differentiator at the MIT ID Innovation Program?
I'll have a prologue to the answer. I'll come to the answer, but I'll start with the prologue.
Yeah, so because you've seen both the sides now. You've been at both sides of the table now.
Yeah. So I'll start my journey from my engineering project. My engineering thesis project, me and my project group, we were very, very clear. We wanted to build something. We didn't want to do a theoretical project. And so we built a jet ski. We built like a proper jet ski with engine, and we could take it into the water and sail it. When I went for my design post-graduation at IDC, IDC harped a lot on social innovation. They were very, very supportive of projects that would cater to social problems. And my motivation over there was to design something, but I never thought of any of these projects as projects that would go out in the market. They were more academic. They were filed in a report and they probably sit cozily on my shelf. The difference at Stanford that kind of opened my views around whatever projects I was doing was that these projects have a significant chance of becoming entrepreneurial. They could become startups. They could go out in the world and actually, I could live that dream. And I think now when I shift I have recalibrated my thinking around how I look at entrepreneurship. I think entrepreneurship is much more business. After the innovation, after the invention, the innovation is in doing the business, and there's a lot of different skills that you need there. And I have chosen my entrepreneurship model to focus around design, and that's why I'm a design consultant. At the innovation program, from the day one, when we kind of disperse this innovation process to the students, my encouragement to all the students is to not look at it as an academic program. I think that academic program is providing you a foundation to be the next startup, to be the next social entrepreneurship. And that is where my more is on, to kind of motivate the students to say whether they want to continue project. It has a calendar the program.
Sure. Anand has a question. He's saying, what are the tools which MIT ID innovation programs are having? So I guess it's pretty much in line with the differentiator, but maybe you could add further to it.
I think, see, there are hard tools and soft tools, and being housed in a fantastic facility that has prototyping and access to experts who can help you with different technologies, I think the biggest tool is the enabler of the community that the MIT program is in. The MIT program is, I think I've seen this program very differently. My interaction with the program is for the 6 weeks or the 16 weeks, sorry, the 16 tutors. I think they are just facilitating the thinking process and enabling you to access the network that the practitioners have. I think that is a bigger tool than anything else for this program.
Sure. So I believe there's one more question from the user of Galaxy M30. I believe he's a designer or she is a designer. It says, when doctors, engineers, or non-designers get into our space without much understanding designer's perspective and try to change some important design aspects in the product, how to deal with this?
I think that's a brilliant opportunity, isn't it? You have a mind frame that is able to help these people converse. I think design as an academic program teaches you empathy that no other academic program teaches you. Engineers, we are not taught empathy as a curriculum. Doctors program from the but they deal with it very differently. So if you can have empathy for your team members, you can bring them together and have a conversation their distinctive vocabulary and languages. I think that's the foremost role as a designer, and you are greatly empowered to do that.
Sure. Subbu Kanmani would like to know, if you can answer, of course, that how to do clinical testing for the health products. Is there any agency that you can recommend for certification in this current situation?
That's a very detailed answer
Right.
that this demands. I think we should take it more offline, but it's
Sure.
fairly complex how you do. Different devices have different clinical testing protocols, and the answer will be particular to the device that you are working on.
Sure, sure. Another question, how far is India in terms of innovation to making living bots that can do surgeries, of which University of Vermont has contributed to millimeter-sized xenobots from frog embryos? I think pretty much this will be the last question. We have like 6 minutes more. Yeah.
I think we should not calibrate the answer in we should calibrate that answer in terms of, is there a pressing need for these robots right now? If the design community, if the innovation community should focus on solutions that are high end like that, or is there a much more pressing need? It kind of comes down to what I've been saying. How do you choose a need? I think India has not felt the need to make that choice so far. There are much more pressing needs, and that's why efforts have not focused around it. Though there are efforts at IIT Chennai, IIT Bombay that I'm aware of that are making devices very similar in terms of the robotic surgery devices that you're requesting for. It's a matter of choice. Observing from problems that demand robotic surgery are hard to see because the other problems overwhelm you much more earlier than you reach the robotic space.
Great. I guess we'll have more questions taken up offline, quite a few coming in as well. You've got all our social channels and of course Pushkar's details as well. I would now formally like to thank Pushkar for taking time out and sharing about his journey and insights, and of course answering all those questions which are still rolling in. Thank you so much, Pushkar. Great experience having this webinar with you, and fantastic coming to know in terms of all that you're doing during this difficult situation, and in a way leading the way for all of us. I would also like to invite the participants to our next webinar, which is on the 8th of April. That's being led by Mr. Nitin Sisodia. Do reach out to us and kind of stay tuned in to our social channels. Pretty much 2 webinars every week coming in, just to keep you company, to keep you intellectually engaged during this current lockdown. We hope that the lockdown ceases soon. We hope that life resumes normalcy soon enough. But nonetheless, I think it's up to us as the citizens now to take care that we are better prepared for the pandemics ahead. This is possibly just a teaser, but I think we need to all start thinking creatively and start innovating, and also reach out to all the innovators who are already doing great work. And one of them is Pushkar Ingale. So thank you so much, and we'll wind up now. Thank you so much.
Thank you. Stay safe.